psychological ramifications of red pill and incel subcultures on women, an academic analysis of radicalized misogyny, digital trauma, and clinical outcomes. The proliferation of the manosphere, red pill, and involuntary celibate incel ideologies inflicts profound psychological distress on women. This comprehensive, multi-layered academic analysis outlines how radicalized digital subcultures shift online spaces into psychological battlefields, causing severe clinical deterioration. The document synthesizes the structural dimensions of the digital hostility and details the resulting severe psychological and physiological coping mechanisms observed in targeted women. Primary core dimensions of ideological distress: dehumanization and objectification. Pseudoscientific, reductionist frameworks common within these subcultures systematically strip women of individual agency. By reducing complex human beings to rigid biological stereotypes, sexual currency, or hypergamous archetypes, this rhetoric induces chronic emotional exhaustion. Targeted women are frequently forced into harmful cycles of self-objectification, constantly assessing their own safety and worth through a distorted adversarial lens. Stochastic terrorism and hypervigilance. Online misogyny frequently transitions from toxic rhetoric into real-world violence. This unpredictable threat landscape fosters a psychological shift from baseline trust to permanent defensive threat scanning. Because attacks are unpredictable yet statistically certain to occur at a macro level, women suffer from profound hypervigilance, anticipating hostility or physical violations in both public and private life. Erosion of digital sovereignty. Coordinated online harassment campaigns, mass trolling, and doxing, the malicious leaking of private information, result in significant psychological displacement. Women facing these vectors are forced into self-censorship, withdrawing from public discourse, digital careers, and social networks. This systemic loss of digital autonomy directly threatens personal identity and professional stability. Interpersonal strain and systemic distrust. As toxic algorithmic echo chambers introduce radicalized views into mainstream platforms, everyday cross-gender relationships experience structural friction. Women bear an immense emotional labor cost, vetting peers, co-workers, and romantic interests for hidden radicalization. This pervasive atmosphere damages social cohesion and compromises organic, safe bonding. Clinical outcomes: depression, anxiety, and behavioral risks. Victims of sustained psychological aggression from these digital networks often experience a severe systemic breakdown of self-worth. This prolonged exposure can rapidly transition from situational stress into severe clinical depression, characterized by deep feelings of hopelessness, persistent sadness, and debilitating loss of interest in daily professional and personal activities. Concurrently, the constant state of hypervigilance required to safely navigate both hostile online platforms and physical spaces triggers chronic anxiety, somatic physical symptoms, and acute panic disorders. When individuals are subject to intense targeted social isolation and dehumanizing online rhetoric, this accumulated emotional trauma frequently strains natural defense mechanisms. In professional clinical settings, it is critically observed that such extreme emotional distress drastically escalates the risk of self-harming behaviors and other maladaptive coping strategies. These behaviors emerge as a desperate attempt to externalize, suppress, or manage overwhelming, unceasing psychological pressure. Cognitive distortion, erosion of reality, gaslighting, and disassociation. The systemic erosion of reality, which is heavily accelerated by collective online gaslighting and ambient abuse. When victims are repeatedly told by vast digital crowds their documented experiences are invalid, fabricated, or inherently flawed, their core ability to trust their own senses and perceptions begins to fail. This calculated psychological manipulation triggers intense cognitive dissonance. Victims are left trapped in a state of profound confusion, struggling endlessly to reconcile their lived reality with the aggressive, distortive narratives pushed by coordinated factions of online aggressors. To withstand prolonged exposure to such hostile trauma without complete psychological collapse, the human mind frequently deploys disassociation as an involuntary defense survival mechanism. This severe mental disconnect from the present moment, while temporarily numbing pain, severely complicates a victim's long-term sense of self-agency. Consequently, deliberate psychiatric efforts towards identity anchoring, the intentional grounding of a patient in the stable, objective, and factual aspects of their personal history and physical environment, become highly critical, yet extraordinarily difficult to sustain under the weight of continuous psychological warfare. Yes, red pilling absolutely leads to self-harm in women. And no, I think it needs to be said that I am not with anyone. This is my content. A certain group has been trying to take credit for my content and threatening to undermine my ability to do it if I do not let them. Stop trying to glom on to what I do and commit intellectual property theft. You know who you are.